Um, I every time I do this, I can never tell if I'm doing it right. Something about anyway. Um, so I thought I would come back and do an update on from my last video when I had my first appointment with the pain management clinic, and kind of give you a recap of how my second appointment went. And I also saw my new therapist for the first time yesterday. It was a virtual appointment. So let's talk about the chronic pain follow up appointment first. And let me see if I can adjust this because I feel like, um, hold on. Sorry to be like all up in y'all's grill, but I'm trying to get this to where it will be steady. Okay. So I went to the follow up with the chronic pain practice. I can't I can't say I saw the doctor because I have yet to see her. Uh, each time I go, it is a nurse practitioner, which I have no issues with. But my first issue with the appointment was I did not see the same nurse practitioner. And when this new one came into the room, it felt like either the person I saw at my first appointment didn't put any notes in my chart, or the person that I saw at the second appointment did not read the notes. They asked me to go get my records from the neurologist's office where I had my MRI done back in February so that they could read the report and see what the findings were. I had picked that up and dropped it off to them about a week to 10 days after my first appointment. So that it was a month, give or take, that they had the report. At this second appointment, which was last Thursday, the nurse practitioner read the report while she was in the office with me for the first time. So I was quite frustrated, I think is the right word, because I wasn't expecting her to know like my entire history, from the start of the issues until today. I was expecting her to have some idea what was going on. So she walked in the room and sat down. First thing she says is, "So, are you planning to go back to your neurologist? Are you planning to have surgery?" And I'm like, I talked about this with the first nurse practitioner and told her the whole I thought we had a plan that she put notes about in my chart. Foolish, I know, for me to assume that. So I had to recap for her what I talked about at the first appointment. I'm trying to avoid surgery until, as long as possible, realistically, but at least until I'm eligible for FMLA at my current job. I have only been there 5 months, so I have a ways to go. Um, and if I can, you know, I wanted to do the steroid injections, and hopefully that will buy me some time, maybe longer than 7 or 8 months. Who knows? So I kind of went through that real quick and told her, what I had discussed with the first nurse practitioner. And then we moved on to, she asked me a few other questions, general questions. And then I told her I had called them back about 2 weeks after the first appointment to ask if it was possible to adjust the dosage of gabapentin, because she had written the prescription for me to take one pill twice a day, and each pill is only 100 milligrams. So I wanted to try 200 milligrams twice a day because the 100 wasn't cutting it. And I called and they put me on hold, and then the girl came back and she was like, "Well, you're scheduled for a follow up in a couple of weeks. You can talk about that when you come in for your follow up." And I was like, "Oh, okay." So I told Babe what they said, and he was like, "Well, that was dismissive." I said, "Okay, so it's not just me." Because sometimes I have to check and make sure I'm not, um, it's a long story. I'm gonna talk about that in the next part when I get to the therapy update. Okay, so she said, well, they could have done that, for you that day, and I said, well, that's what I thought too, but apparently not. So she did adjust the prescription, and I guess gabapentin doesn't come in a 200 milligram pill, so I take two 100 milligrams twice a day. And I was not wanting to take it at work, but it's at the point now where I don't have a choice. So what I do is I usually have breakfast on my way to work that I've made at home, or I pick up something and eat it once I get to work while I'm typing notes or going through emails or whatever. And then I take the first dose around 6ish. I don't feel impaired when I take it, but I also don't want to have to take it when it's close to time for me to leave because I really don't want to drive while I'm taking it. So, but it is not a narcotic. It's an anticonvulsant, but it does make you a little bit sleepy or groggy sometimes. So I do that, and then by the time I get ready to leave work, 8 hours later, 9 hours later, um, it has pretty much done what it's gonna do and has started to wear off. And then once I get home, I kind of, for lack of a better phrase, thug it out until close to bedtime, and then I take the second dose and I take a muscle relaxer. They changed me from Flexeril to methocarbamol, which works a little bit differently in the body. Flexeril has more of a sedative effect, and she did mention, the first nurse practitioner did mention that the methocarbamol was very different, and I wouldn't feel sluggish or like hungover when I woke up the next day after taking it, that was right. And then it also, because of how it works differently, it does not cause as many digestive issues for me. So I'm not dealing with heartburn and reflux and constipation and all that. So I scheduled the first round of steroid injections for next month, and I scheduled it on a day when Babe is off. I probably won't need him to drive me because I was informed that they don't do like sedative anesthesia unless you're doing the neck area or the cervical spine. I chose to get the first round of injections in my thoracic spine because that's causing me the most discomfort and issues as far as sleeping, being able to sit, um, and do other things. So I'm going to do the thoracic spine first. Then you have to wait 3 months before you can get another round, and if you choose to do a different part of the body, then she was okay with letting me pick whether I want to continue with the same area or if I need to try a different area, and we'll see how it goes. So that was kind of how that appointment went. But I'm still using a combination of several things. I made a very disturbing discovery. They had prescribed me lidocaine patches the first time, but my insurance did not cover them. And the lady at the pharmacy said, well, we have them over the counter if you want to get those. It's just 1% difference in the strength. And at that first time, I decided not to buy them. Because I had bought some lidocaine cream before, and I didn't know like if it was, because it was topical and not going directly onto the area. I didn't know what it was, but it felt like I was on fire. And I didn't know if it was like an allergic reaction to the lidocaine or um, like my skin was sensitive. I didn't know what was going on. So I had tried that lidocaine cream like 2 or 3 times, and I decided not to try to use it again. So this time when I went to pick up my prescriptions, I bought the over the counter lidocaine patches. And I came home and I took one out and put it on my back, and I had taken a shower and everything. And I remember about 10 or 15 minutes after I put it on, maybe not even that long, maybe more like 5 to 10 minutes, it felt like I was literally on fire all around my waist and down both of my legs. And I said, okay, it's got to be the lidocaine. Something about this is just not going to work for me. So I ended up doing an AI assisted search to figure out if there was some specific reason the lidocaine was giving me that kind of reaction. And basically, what happens is because of where I have um, the damage, the nerve damage in my spinal cord, and because I have what's called allodynia, because it makes the nerves in the skin super hypersensitive, and it things that shouldn't feel painful cause you a considerable amount of pain, like wearing clothes, shower water hitting me, um, any type of fabric brushing against my skin, even if I'm wearing something really loose fitting, like if it slightly brushes my torso area, it feels extremely painful to me. So apparently, if you have that particular symptom as a result of nerve damage, lidocaine can greatly increase your body's reaction to it, and it can make you feel like you're literally on fire. So I wasted, I don't know, $10 on that box of lidocaine patches. I'm gonna see if I can, find somebody that might be able to use them, give them to my brother. I don't know. So that is how my follow up with the pain management clinic went. Apparently, I will get to meet the doctor because she actually does these steroid injections. And when she does other areas like the thoracic and the lumbar spine, it's not sedation. She only does local anesthetic. And I'm wondering, more than likely, it might be lidocaine that they use to do locals. So now I'm thinking, how is that going to work? Am I going to have the same reaction I had to the topical lidocaine? I don't know. I'm really, to be perfectly honest, I'm very tired of thinking about this and trying to figure out the best way to go about treating this issue. Which is why I am in my lounging clothes and I look like I look, because I got home from work and I wasn't gonna do a video at all. And then I was like, okay, it's been a month. If I put it off, it might be another month. Plus, I really wanted to talk about my therapy appointment. So yesterday was my first virtual appointment with my new therapist. My health insurance kicked in August 1st, and I started trying to find somebody locally at first to see that where I could go to like an office and see somebody in person. But then I decided, you know what, I'm tired of this. And then I couldn't get anywhere on my insurance company website or Psychology Today to figure out who was local, who took my insurance, because I live in Alabama, but the corporate office of my job is in Dallas, Texas. So I have Blue Cross of Texas, which hasn't been a big deal so far. So I finally went on the website called Grow Therapy, because when I lived in Florida, that's how I found my therapist in Florida. She was on Grow. And they do like all the insurance stuff, and you book your appointments through there. You can send messages to your provider if you need to talk to them about scheduling or whatever. They can send you information. You do assessments on the website, and then it pretty much sets it up to where you only talk to your provider about your issues and the insurance and all that other stuff. And I like it because you can put your insurance information in and they'll give you like an estimate of what your copay is and all of that. Okay. I don't know if that recorded my conversation. I hope it didn't, but my husband was calling. But anyway, my therapy appointment. So she's very knowledgeable, very intelligent, like super intelligent. And it was just an intake appointment, but I did kind of get off on a tangent of telling her about my primary reason for wanting to be in therapy. And she asked me a few questions, and then about halfway through, I divulged that I am a clinical mental health counseling graduate, recent graduate, and so I'm not practicing or licensed, but I understand the process. And so she basically was like, well, I'm going to treat you like I treat any other client. as far as how I educate you about my the way that I operate as a therapist and what you can expect. And I was like, that's great. I really appreciate that. I want you to treat me like any other client. Because obviously, if we could heal ourselves, we wouldn't need to seek out a therapist. But I'm always going to be a proponent of a therapist having a therapist, just because you need one when you're helping other people with their mental health. Um, More on that later. But we did a quick intake. I did some assessments to kind of gauge the level of any depression or anxiety I may be experiencing. We talked about chronic pain. We talked about trauma. She is trauma informed and has experience working with people to help them overcome their trauma. And this is where it got interesting. So once I gave her a little bit about my original reason for starting therapy back in 2020, as I kind of wound up the uh, synopsis of the last 5 years of my life and how I got to this point, she asked me if I had ever worked with a trauma therapist, and I said no. So she said she would like to do some internal family systems work with me. And of course, I studied internal family systems in school and learned about that particular method or modality, but I've never seen it in action. Like, I've never observed a clinician work with a client to do internal family systems. When I've been in supervision during my internship, I listened to another intern. Well, was he an intern? Yes. I listened to another intern talk about his work with a client using internal family systems. And basically, what it is the self is your primary identity, your true, authentic version of you. But when you go through trauma or something traumatic, you have different versions that can either work with the self or detract from the self. There's the firefighters, that's the parts of you, and it's also called parts work or parts therapy. The firefighter part of you is the one that comes to the rescue. So when you start to feel uncomfortable emotions or get in a situation that triggers you, the firefighter can rush in and do things that will distract or help you dissociate or some other unhealthy coping mechanism to take the focus off of the uncomfortable emotion or situation. The manager part of you is the one that keeps everything running on a tight schedule, the overthinker, overplanner, people pleaser that tries to avoid at all costs any situation that will bring up unpleasant emotions. And then there's I knew I was going to forget one, the manager, the firefighter. Ugh, what is the other one? The exile. You may have one or more exiles. The exiles are the ones that hold the difficult or painful memories, emotions, situations that we try not to remember. And the exiles usually aren't called on until either the manager is not in control or the firefighter gets distracted, and then the exile can kind of take and compartmentalize the unpleasantness. And so this is my personal interpretation of internal family systems or parts. I feel like for me personally, this is going to be extremely helpful because I feel like I have several exiles at different ages. I feel like I have an exile that's 5 years old, and that's the age I was when the initial trauma happened. Or as far as I know, I'm sure there was things before that as an infant and a toddler that, you know, because my parents believed in spanking. Um, but there's a major one that happened at age 5. I feel like there's an exile part of me that is around age 8 or 9. That's when my parents split for the final time because they had reconciled a couple times when I was younger. But that final time, I think I was in third grade, maybe, where they decided that this is it. They weren't going to try to reconcile and be married anymore for real this time. Like this was the last time. And then I feel like there's an exile part of me at age 15, which is the age I was when I met my first husband, my ex-husband, my husband. And that exile part of me holds a lot of guilt and shame. And then I feel like my manager is the constant in my life. My manager is running the show. That's the overachiever, the one that's doing all the things and getting all the accolades and the accomplishments and the awards and the fanfare and the praise. Because if you can appear to be perfect, which managers, one of their characteristics is perfectionism. If you can be perfect, then nobody criticizes you, and you don't have to deal with the discomfort of criticism. Even when it's constructive, it can still. It's just within the last couple years that I have learned to listen um, without offense when people offer me constructive criticism or feedback. I mean, not very long ago, maybe more than 2 years, not more than five, it would be painful for me to think about feedback that people gave me or when they would try to tell me how I could do something better. And that would set my manager off. The firefighter part of me, I have not, I can't say that I'm very familiar, but I do know that the firefighter part of me is the one that likes to binge eat, the one that has the unhealthy coping mechanisms, the one that likes to sit and doom scroll or watch episodes of a show over and over again. That's the part of me that likes to dissociate. So I'm not going to do a whole lot of research and deep dive into parts or internal family systems too much because I'm a little bit neurospicy, so I can get off into the weeds quick when I when something piques my interest. I'm going to operate as a client and let her guide me where she feels like I'm ready to go with this internal family systems work. I'm excited to work with her though because she's the type of therapist I wish I could have interned under. Like her demeanor, she's very warm, very, open-minded, non-judgmental, and she explained how she operates her practice and how she operates as a therapist, what I can expect from her, what she expects from me. Confidentiality and HIPAA, if we live in different parts of the state, but if by some chance we end up seeing each other in person in public, how she would react, and it's up to me whether or not I want to initiate contact. If I do, she will obviously respond, but if I don't, then she'll look at me and act like we've never met a day in our lives, which is how it's supposed to be ethically. That's how you're supposed to interact with patients or clients that you see in public. Um, and this was a new one on me. Now I do this at work, and I have done this at work since my previous job, my first job as a counselor in substance use treatment. When you create a treatment plan, it's supposed to be a collaborative effort. And we would give, at my last job, we would give the patients or the clients a copy, and they were encouraged to refer back to it to see if they were making progress on the goals that were set. In this current job, we offer them a copy, but because it's outpatient, they really don't want us to just be printing up a bunch of treatment plans if they're going to be floating around the parking lot or the lobby. And people, most of the time when we offer them a copy, they don't want it. They're like, that's just more paper for me to lose or try to keep up with. And I get it, because for a lot of them, given what I do now, they're in maintenance mode. So they don't really need a copy of that treatment plan. It's pretty much the same with a tweak here or there. So she told me it'll take her about 48 hours at the very latest, the end of this week, to send me a copy of my treatment plan. And she wants me to read over it and let her know if I want to make any changes before she finalizes it. And then we work together as a team on my goals. And she asked me specifically what I wanted to work on. And I told her, I feel like I have come miles in my personal growth and development since I started treatment in 2020. At that time, I had a very specific reason for going to therapy, and it was related to that trauma from age 5. And so I was basically in somewhat of a crisis, and I needed somebody to help me get stabilized. And I worked with that therapist until the end of 2023 when I moved to Florida, which was 3 years roughly. And the only reason I started working with her was because she was obviously not licensed in Florida. She was just licensed in Alabama. And all they make you go through to get a license, there's not a lot of therapists that are licensed in more than 2 to 3 states because it's a headache. I'm hoping that they work out that compact so that by the time I get licensed, it will be like a like a countrywide type thing where if you're licensed in one state, you're good in all. That's the premise of the compact, pretty much, for mental health licensing, counseling licensing. But I have gone through different stages of my healing journey with different therapists. She is my fourth that I'll be seeing long term. I really don't count the one I saw initially when a month or so ago when I went through the employee assistance program before my insurance was active. I really don't count that because I was just trying to get somebody to help me navigate one or two things in the meantime. But I knew we were not going to work together long term because we weren't a good fit. When you work with somebody in a counseling capacity, you have to have the client or patient's permission to bring Christianity or religion into the session as part of the discussion. And she did not ask me specifically if I was okay with that before she started giving me biblical principles as part of her suggestion for me, as far as how to work on a problem that I was having. And I'm not going to go into detail about what it is, because what she told me to do, because I understood why she did that, and I know like where it was coming from. It was not coming from a malicious place, but at the same time, you just assume that I am okay with Christianity and religion, and that we can, just for whatever reason, she felt like it was okay to bring that in without asking my permission. And she was a little bit older, and sometimes they tend to feel like they can do and say certain things and get away with it because they're older. And I just wasn't feeling it after that. So that kind of damaged our therapeutic alliance. But if you made it to the end, thank you. I will probably do another update in a couple weeks because right now my therapist wants to see me once a week, and I agree that that's what I need at this particular moment because I'm dealing with some things that need to be addressed on a weekly basis. I may go into more detail after another session or two, but for now, that's where I'll leave it. So thank you guys for watching. If something happens that I feel is worthy of another update, I'll come back and record another video. But for now, I'll probably see you guys in 2 or 3 weeks. And thank you for watching, and I hope you enjoy the rest of your day. If you have any questions or want to, chop it up in the comments, leave me a comment and I will respond. I enjoy talking with y'all in the comments. Babe is on his way home, so I'm about to do a couple things. I got some laundry going, but there's a couple things I want to get done before he gets here. And yeah, that's it. So I'll see y'all next time. Bye, guys.